So you want to learn about urinary tract infections, or UTIs for short. Most of the time, they take over your bladder for a few days, and it really hurts to pee. They also make you rush to the bathroom, so it's hard to relax. You may notice your urine has a reddish color. That means you're passing some blood into the toilet. 1 in 2 women suffer with these pesky infections, and if they happen 3 times or more a year, you may want to learn how to prevent them. You're at higher risk for a UTI if you're pregnant, if you have diabetes, kidney stones, or a weakened immune system, or if you need to wear a tube to empty your bladder. You're also at higher risk if you have multiple sex partners, or use spermicides for contraception. After menopause, the lack of a hormone called estrogen and a weak pelvic floor are top offenders for causing UTIs. Sometimes people need surgery to fix their pelvic floor. Right after, the chance of getting a UTI is very high. We know most UTIs are caused by a hairy bug called E. coli, which loves to cling to the inside of your bladder. E. coli normally lives in your gut and stool, but it's so tiny that it easily moves around your bottom. No amount of drinking, washing, douching, wiping front to back, frequent peeing, or peeing after sex will help get rid of it. Actually, douching can be quite bad for your vagina. Before menopause, a good bug called lactobacillus naturally lives in the vagina and fights off E. coli. Lactobacillus loves estrogen, which is typically in short supply after menopause. Keep in mind, there are many proven ways to prevent UTI and make sure you don't suffer again. Believe it or not, cranberries knock those pesky E. coli right off your bladder wall. To get the right dose, forget about the juice. Take cranberry tablets instead, and make sure you take enough. Experts recommend 36 grams of cranberries per day to prevent UTI. This dose has been shown to work, especially if you take it daily for 6 weeks after pelvic surgery. If you're sexually active and using spermicide, consider speaking to your doctor about an alternative. If your UTI is related to sexual activity, your doctor may prescribe a small dose of oral antibiotic that you can take around the time of sex. If you're pregnant, your doctor will make sure the antibiotics prescribed are safe for pregnancy. Even if you feel better after a couple of days of antibiotics, please make sure you finish the full course to stop bad bugs from coming right back. If you're postmenopausal, consider vaginal estrogen, or even a small dose of daily antibiotics if all else fails. Sometimes, these simple methods don't work to prevent or treat UTI. Also, strawberry red urine is not always a UTI and may come from other diseases of the bladder, the kidneys, or the tubes that link the two. You may need further investigations from a specialist, such as a urologist or a urogynecologist. Then again, it may be that you just like those beets too much. So remember, UTI means your bladder can't protect itself from some bacteria, and this is very common. Frequent, painful peeing and strawberry red urine are classic symptoms. Red urine alone may be a sign of more serious disease. Please see your doctor if symptoms persist for more than 24 hours or occur more than 3 times a year. To prevent UTI, consider the use of cranberry tablets, replacing spermicide with another form of contraception, antibiotic use around the time of sex, and using vaginal estrogen after menopause.